Hi, this is Dr. Woeller from Integrative Medicine Academy, and I welcome you to this video. So the title is Why Nutritional Supplements, Multivitamin, Multimineral, make sense for most people to use. And the reason I wanted to talk about this is I see a lot of protocols and different recommendations sometimes online for different types of health conditions where very few things are being used. So for example, in the autism community, for example, it's well known that a lot of these kids have chronic digestive problems. And so there's a well-known protocol that recommends just doing a few things to try to improve bacterial and yeast overgrowth in the gut. But then nothing is done with regards to foundational supplementation. And it leaves a lot of kids vulnerable for nutritional deficiencies, which I'll talk about here shortly. And so this issue potentially expands to other type of individuals who have, whether it's cardiovascular problems, autoimmune, metabolic syndrome, or other types of disorders. We often get, or should be getting, a wide variety of nutrients from our foods, but that doesn't always happen with everybody. So I wanted to get into that topic a little bit more. So I'm Dr. Woeller. I've been an integrative and functional medicine physician for over 2 decades. I do a lot of clinical education on my own, as well as for different laboratory companies like Great Plains Laboratory. I speak throughout the United States as well as internationally. I'm an author. I've been in clinical practice now again for probably going on since about 1998, so well over 2 decades. I'm the co-founder of Integrative Medicine Academy, which is an online academy with training programs for healthcare practitioners interested in integrative medicine. I'm also the medical director of Functional Medicine Clinical Rounds, which is a website to help support one-on-one practitioners looking for lab test interpretation and case analysis. And then in my own practice, I work a lot with the autism community, patients with gastrointestinal, neurological disorders. So the rationale for using sort of general vitamin and mineral supplementation, which provides a wide variety of nutrients from different vitamins, B-complex vitamins, vitamin C, vitamin A, minerals, essential fatty acids, and then oftentimes these products provide some level of antioxidant support. And so basically what we're looking to do is supplement for a healthy diet. And in an ideal world, again, we'd get all of our nutrients from our diet, but that doesn't always happen with people. And so we need to be practical and understand that even though our best efforts are to improve the quality of our diet, we still may need some nutritional supplements to fill in the gaps. A really good book called The Longevity Diet by Walter Longo highlights the fact that healthy eating is something more along the line of a Mediterranean diet, is being shown to play a significant role in decreasing disease onset and improving lifespan. So if you're interested in that topic, I would encourage you to look at his book. So there's a lot of research that shows that people just aren't getting the nutrients from their food. And that could be either the quality of food they're eating or where the food is grown. We know that a lot of the topsoil in the United States has been depleted of minerals over time. And this was a report that came out from the Centers for Disease Control talking about that people just aren't getting enough nutrients. Things like iron and vitamin D and iodine, for example. So 9 out of 10 people, according to the CDC, aren't getting enough adequate nutrients. So folate, iron, iodine, like I just mentioned. And there's certain groups, for example, that tend to have higher levels of deficiencies. So non-Hispanic blacks, for example, have low vitamin D. We know that vitamin D is very important for immune function. Mexican Americans tend to have higher rates of iron deficiency compared to non-Hispanic whites, for example. And so again, if you start looking around online, whether it's WebMD or Medscape or other reputable websites, a lot of information about this. And that doesn't mean everybody is nutrient deficient, okay? But a large percentage of the United States seems to have some level of deficiency in certain nutrients. We know that magnesium is often deficient in many people. Let me just real briefly discuss autism, and I realize not everybody either works with autism or has a loved one with autism, but it's an important topic nonetheless. Autism is on the rise, and it has been now for many, many years in the United States and around the world. And what happens with individuals with autism, whether they're kids, teenagers, or adults, is they have social impairment issues, communication problems, and repetitive type of behaviors. And sometimes it's very, very severe. And there's different causes of autism. But what is true about autism is that the vast majority of these individuals tend to have very limited diets. Now, the Centers for Disease Control has recognized for years that there's many comorbid conditions in autism, from seizure disorders to sleep problems to headaches to gastrointestinal issues. And a lot of times with the gastrointestinal problems, when they are worse, the autistic characteristics are worse too. Well, I would also add to this list nutritional deficiencies, primarily because many autistic individuals are very rigid in what they'll eat. I've actually seen individuals who will only eat 4 or 5 different types of foods, and they'll do that for years. And there's been research that's looked into this. This was an article that came out of 2011 that was looking at the nutritional and metabolic status of children with autism versus neurotypical children, and then associated autism severity. And what they found when they looked at blood markers and biomarkers was these individuals with autism tended to have low levels of things like biotin and glutathione and certain amino acids. Plasma sulfate was lower, which is something important for detoxification. And then they had tended to have higher levels of oxidative stress, for example, which could be damaging to the brain and nervous system. And so vitamin deficiencies were quite prevalent, which increases oxidative stress, and that also decreases the ability for energy transport. And what they mean by that is that the energy metabolism at the cellular level is compromised. And a lot of these individuals have what are called mitochondrial dysfunction that compromises brain function, immune function, gastrointestinal function, etc. And their ability to detoxify toxins that they come in contact with. All of these systems are dependent on adequate vitamins and minerals that we should be getting from our food. Another paper came out in 2018. It was a 12-month randomized controlled trial looking at individuals with autism and nutritional deficiencies. And like the previous one, they found that the group, 67 children and adults with autism, okay, had lower levels of various nutrients, B vitamins, folic acid, coenzyme Q10, for example. And when they were placed on supplementation, there was improvement in their nonverbal intellectual ability. Okay, so just, the environmental awareness and cognitive skills. And that was seen, really universally across the spectrum of individuals in the autism group. And so the parents reported that when vitamin mineral supplements were used, essential fatty acids were used, again, there was an improvement in their overall cognitive abilities. And this is something that I've seen in my practice for years. It's not to say that vitamins and supplements are a cure-all for autism, okay, but they're an important component, if nothing else, to just improve their overall health and quality of life. So I'm a huge proponent on healthy eating. All of us can improve the status of what we eat, the quality of what we eat, and a lot of times it's just getting rid of toxic food that makes a big difference. So incorporating a whole food diet is really, really important. But again, depending on an individual's ability to access organic food and non-GMO food, for example, in a diversity of food, we still may run into some subclinical vitamin and mineral deficiencies. There are many good companies that provide supplements to healthcare practitioners as well as the general public. New Beginnings Nutritional is a company I work with a lot in clinical practice. And, for example, this is their daily resource. This is a multivitamin, multimineral that has a robust amount of different nutrients. Again, the way I look at these things is they help to fill in the gaps nutritionally. You're not going to overcome a bad diet with just supplements. Diet has to play a role. So we all have to do our part to improve the quality of food that we're eating. But again, the nutritional supplements can just provide some additional support. Omega-3 fatty acids are very important for many individuals for overall immune health, for cardiovascular health, as well as brain and nervous system health. And even the American Heart Association recommends that everyone, eating fish at least twice weekly, things like salmon, for example, low mercury type of fish, in that it has a beneficial role in improving brain and nervous system function. So they've done studies on helping with depression and anxiety, improving risk factors for heart disease, reducing inflammation, improving mental health disorders, as well as improving metabolic syndrome. Patients with Alzheimer's disease can get benefit. We know that essential fatty acids help reduce fatty liver disease, which really is actually becoming an epidemic worldwide. Improvement in skin, improvement in joints, improvement in bone health, as well as helping to prevent some types of cancers like breast cancer and colon cancer. Let me talk a little bit about mitochondria. Mitochondria are the energy factories of our cells. Okay, this is what provides that energy currency that runs the machinery of our body. Every organ system in our body is dependent on a chemical called ATP that the mitochondria produces. And so ultimately what's happening is that the proteins, the carbohydrates, the fat that we eat, which should be nutrient dense, funnel down to something called the Krebs cycle. The Krebs cycle moves compounds into what's called the electron transport chain to produce ATP, that cellular energy currency. But all along the way, between protein to amino acid conversion to carbohydrate to fatty acid conversion, requires various amounts of nutrients, as well as nutrients within the Krebs cycle and the electron transport chain. One particular enzyme that's worth noting here is called Pyruvate dehydrogenase complex. And right here, it actually requires a number of different nutrients: B5, thiamine, B2, something called NADH, lipoic acid, even magnesium. And so deficiencies in those nutrients can compromise this enzyme, which then compromises the ability to metabolize glucose appropriately. If we go into the Krebs cycle, that enzyme, pyruvate dehydrogenase, requiring those nutrients, well, this enzyme, these nutrients also activate another enzyme called alpha ketoglutarate dehydrogenase. So if we don't have enough nutrients, we not only cannot engage the first step of the Krebs cycle, we also block other steps. And when we get a decrease in Krebs cycle function, we're getting a decrease in mitochondrial activity, which ultimately leads to a decrease in the ability to produce the cellular energy chemical called ATP. And if we think about it, it takes a tremendous amount of biochemical organization and physiological function to have our body function normally. our brain and nervous system requires a tremendous amount of energy on a moment-to-moment basis. But think about your heart and your cardiovascular system. Your heart, your entire life is beating, okay? Thousands and thousands of times per day to pump blood throughout your body. That all requires energy. And we take these things for granted until they stop working well. But every system, from your digestive system to your immune system to your hormone system, respiratory system, none of these cells, none of these organ systems work if they're not being supplied with energy. So the Integrative Medicine Academy is, as I mentioned before, an online training academy for courses in functional medicine. And we teach a lot about nutrition. We teach a lot about the use of different nutritional supplements, whether that's for autism, whether that's for individuals with toxicity issues, from mold, to chemical, to heavy metal. We have an entire functional medicine course that goes through the fundamental aspects of functional medicine, including nutrition and nutritional supplementation. And again, I'm making the case here that I think it makes sense for most people to consider some use of just foundational nutrients, multivitamin, multimineral, some essential fatty acids, along with a healthy diet to just cover the bases nutritionally. We also have courses on the use of organic acid testing and hormone assessment as well. If you are a practitioner who wants to interact with us directly, we have a website called Functional Medicine Clinical Rounds, and practitioners can join this as a membership site and interact with us one-on-one. So you can actually schedule consults with us to go over lab testing, for example, or case analysis. We have educational videos. We have a question and answer forum. And then we also have live monthly clinical rounds, which is a case presentation or a short lecture, and then a Q&A session that follows. So you can actually book a consult with us through the website. Again, we have a Q&A forum, live clinical rounds, and a library of different educational videos. We also have what are called clinical data sheets. And these are one-page documents available as downloads as a PDF that are snapshots of different lab testing, okay, from organic acid testing to heavy metal to blood analysis to adrenal profiles. So fantastic educational material. If you are an individual who is looking to do some functional medicine assessment, some testing, whether it's from Great Plains Laboratory or Doctors Data, other companies, check out Lab Test Plus. Lab Test Plus provides access to a wide variety of testing, and then once the results are back, there is a written analysis of the lab test, providing what are called action step suggestions based on some of the information. So labtestplus.com for a complete list of labs. You can also email to labtestplus@gmail.com for questions. Now, I'm also available for private consultations through our private practice. So here is our contact information, 951-461-4800, our email, and then our website, mysunrisecentre.com. If you are interested in more information about Integrative Medicine Academy and some of the different mastery courses that we provide, please check out the website at integrativemedicineacademy.com, or you can also email us at integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Woeller for Integrative Medicine Academy. Thanks so much.